This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. I am on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. In this discourse, every week I come up with discussions either on Ayurveda, either on Bhagavad Gita and mental health insights, either on mental health and psychotherapy. So, in the last session, we were discussing about autism. So, what is autism? What is the incidence of autism? What causes autism spectrum disorder? And what are the signs and symptoms of autism spectrum disorder? Today, we are going to discuss what are the types of autism and how is autism spectrum disorder managed. So, without wasting time, let's get started. So, here, as I said, to just repeat that autism is a, you know, just to, a recap about what is autism. See, autism spectrum disorder, ASD, is a neurodevelopmental condition. We had discussed this in the previous session. You can go, check out that session on autism spectrum disorder. I'll give the links in the description. So, see, what happens in autism is, see, there are persistent difficulties in social interaction, in communication, and restricted or repetitive patterns of behavior, interests, or activities. So, autism spectrum disorder is more commonly, diagnosed in boys than in girls. So why? See, the incidence, as I said, is boys are diagnosed with autism spectrum disorder at much higher rate than girls. See, studies consistently report a male to female ratio of approximately 4 is to 1. If there are 4 boys affected with autism spectrum disorder, there is one girl affected with autism spectrum disorder, meaning that for every girl diagnosed with ASD, there are about 4 boys diagnosed. This discrepancy in diagnosis rate has been observed across cultures and populations globally. So, here, girls with autistic spectrum disorder may be underdiagnosed or receive diagnosis at a later age compared to boys. This could be due to differences in the way ASD manifests in girls and societal expectations regarding behavior and communication. So, and as I already said, this is a neurological development disorder. So, it basically affects how the child interacts with others, how the child communicates, learn how it grasps things and behave. Okay, although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. This was also discussed in the previous session. So, here, after this, we had also discussed about difficulty with communication and interaction with people, restricted interests, and repetitive behaviors, symptoms that affect their ability, to function in school and work, and other areas of life. So, all this are interrupted in an autistic child. So, autism spectrum disorder and usually encompasses a range of neurodevelopmental condition. I'll talk about it. So, what happens is persistent difficulties, as you can note, in social interaction, communication, restricted or repetitive patterns of behavior, interests, and activities. So, based on this, autistic spectrum disorder is classified into various types. See, um, first thing is classic autism. So, let's learn about what is classic autism or autistic disorder. So, this type is the most widely recognized type of autism. It usually involves significant impairments in communications, social interaction, and presence of restricted and repetitive behaviors. So, how? Let's consider a boy named Apple. So, Apple is a 5-year old boy who is diagnosed with autistic disorder. So, how? He has limited speech and mainly communicates through gestures. He is 5 years old. By the age of 5, the child is able to completely communicate and you know uh, with verbal cues and gestures, and usually in a normal child, this I'm talking about normal child, a normal child is able to completely communicate, is able to completely comprehend verbal and communicational gestures, non-verbal cues. So here in this case, Apple has limited speech. So it is he has speech difficulties and mainly communicate through gestures. He communicates through gestures here. See, Apple displays interest, intense interest in certain subjects or certain objects. See, I already said that autistic children can be highly artistic or highly logical. They may be good at numbers, they may be good at arts, they're very intelligent in those fields, and they're intensely involved in the fields which they have interest. We have talked about it in the last session. So what happens is, often what Apple does is he lining up of the toys in or focusing intently on specific topics. Whatever he picks the toys and he lines it up, and this is his repetitive behavior. So he struggles with social interactions. That means he's always isolated or lonely. He doesn't like to interact socially, so finding it challenging to engage with peers or understand their emotions. So autistic disorder may include language disorders. So in one language, the child may be good, in one language it might not be good. So it they can have language problems. So, and it is usually, autistic children are usually that is the comprehensive evaluation of things is poor sometimes in autistic children. So this is classic autism. This is an example which I said, that having limited speech, limitedly communicating, and communicating to repeated gestures, like lining up toys, and intense interest in certain topics and no interest in other topics. So all this. So in this as well, in the classic autism or autistic disorders, there are levels. So there is level 1, level 2, and level 3. So what is level 1? So let's consider a child, named Strawberry. Strawberry is a 7-year-old girl diagnosed with level 1 autism. So what all we can see in level 1 autism? So level 1 autism requires support. The major thing is, it requires support but not instant support. So here, Strawberry struggles with social interactions, often preferring solitary activities like drawing or playing with puzzles. So as I said, they could be artistic, they could be musically very well, or they could be well in the logicals like mathematics. So here in Strawberry's case, she's very much good at drawing and playing with puzzles. It is her only interest, and she does it in in isolation. She doesn't like to do it with other children. In school, she has difficulty understanding non-verbal cues. She cannot understand non-verbal cues and maintain eye contact. We had discussed this. Children who have autistic disorder cannot maintain eye contact while talking. So with the support, I will talk about the management and the treatment in the session. But here with support, what happens is Strawberry can engage in conversation because this it is not very severe. That means level 1, level 2, level 3 are characterized based on the severity. Level 1 means it is not very severe. Okay. So, with support, here Strawberry can engage in conversation about her interests such as animals or art, but she may struggle with reciprocal communication. Matlab means she will not be able to listen carefully to what others are saying. She might people other children might find her, or be their teachers or peers or her parents might find that she is not interested in their conversation. She can conversate, but in the reciprocal communication she might not be very good. So this is the thing, this is the level 1. That means level 1 requires support. With the support, it can be managed really well. As I said, that autistic children to an extent can lead a normal life like other children. So this is just that it requires support and this can be managed. The second thing is level 2. So level 2 requires substantial support. This is moderately severe. So here level 2, for an example for level 2 autism. So what happens is, let's consider Pista. So Pista is a 10-year-old boy here with level 2 autism. So what happens in level 2 autism? So Pista has limited verbal communication skills. So here also he has limited verbal communication skills and relies on a communication device to express his needs. So he is dependent on a communication device, means any special aids, speaking aids or hearing aids like that. So here Pista finds it challenging to adapt to changes in routine. So what happens is, when the child, in some cases, this also we discussed in the previous session, when the autistic child, if they are fixed to a schedule, even for the minimal changes in the schedule, they get irritated. So and they find it challenging to adapt changes in routine and can be distressed in unfamiliar environments. So in this case, he requires significant support from parents and special education teachers. In the level 1, the child can be managed in a normal school. Here in level 2, what happens is, child may require special attention, and special schools and special education may require. It depends. Again, it depends. Every child is not the same, and the symptoms, the signs and symptoms of differs from person to person. So what happens is, here they require significant support from parents, from teachers, from peers, from relatives and from groups. They require to join some special groups, some special education to navigate daily activities. So this is level 2, requiring substantial support. Here level next is level 3. Level 3 is requiring very substantial support. That means it is the intensity is increased here. Severely, they need a support. Let's consider an example here. See, example for level 3 is, let's consider Almond. So Almond is a 15-year-old boy with level 3 autism. So what happens in level 3 autism? So he exhibits severe impairments in communication. This communication might be, slurred speech related difficulties, and language processing related difficulties, or communicating difficulties, and it is very difficult for him to socially interact. So Almond's behaviors are highly repetitive and rigid. He's a rigid child. That means not even a single shift in the routine he can tolerate, and he has repetitive behaviors such as hand flapping, some gestures, some wild gestures. This might differ from child to child, and he struggles even with basic self care tasks. So here Almond is a 15-year-old. 15-year-olds are quite independent, but here are he struggles with even basic self care, dressing himself or getting ready for the school, packing his backpack. All these things are all he struggles for all these basic self care tasks. In homework, maybe struggle in the homework. He requires constant supervision. That means anyone must be constantly with him. Any parent, any peer, or any teacher, and somebody should be constantly supervising him and supporting him. He should get constant support from caregivers, including help with feeding. Just as I said, maybe he's not able to at times, in severe cases, not feed himself properly, because 15-year-olds are quite independent. Dressing, toileting, these dressing, toileting, feeding are a bit severe stages. Usually they need help for backpacks, packing their bags, and maybe selecting their outfits. They will have the issues with selecting outfits, and packing their bags, and with their homeworks and all. So this is the level 3. So level 1, level 2, level 3, this. So, and for accurate diagnosis and treatment planning, it is crucial to consult with a mental health professional, qualified mental health professional. Okay, and who is a specialist in neurodevelopmental disorder. So the next type we discussed about classic autism. In that we discussed what is classic autism, what is level 1, level 2, and level 3 autism, what happens in level 1, level 2, and level 3 autism. This second type is called Asperger's syndrome. So this Asperger's syndrome, which was considered a separate diagnosis in the past, is characterized by difficulties in social interactions and restricted and repetitive patterns of behavior, but typically without significant delays in language development. So, here in Asperger's syndrome, there will be difficulties in social interaction. There will be repetitive patterns of behaviors, but there will not be any difficulties in language development. That means there might not be speech delay. The communication here, the difficulty in the social interactions is not by the speech delay. Okay, so what happens is, for example, let's consider Vanilla. Vanilla is a 9-year-old girl, is diagnosed with Asperger's syndrome. So what happens here? For example, she is excellent in academics, because here there is no delay in the language development, or in language processing. So she is excellent in academics, particularly in subjects like maths and science. I said that autistic children, some of the children with autism are very good with numbers and science and arts, but struggles to connect with peers. Here's the main trouble: is she cannot connect with the with her friends, and she cannot interact, so she is always isolated. She always is prefers to be isolated. And here Vanilla has keen interest in astronomy. Here in her case, as I said, these children will have an interest in something or the other. I mentioned it in the last session as well. Many of the famous professionals in the world have autism. If you google and see, you will see who are being diagnosed, who are diagnosed with autism. So here Vanilla has a keen interest in astronomy and can talk about astronomy extensively. That means about constellations and galaxies. But she might not be able to talk about other things, you know apart from maths and science. If somebody asks her about geography or social studies or civics or economics, she might not be good at those subjects, and she might be disinterested from talking from those subjects. And the reciprocal communication would not be very good here. So this is Asperger's syndrome. See, Asperger's syndrome also can be dealt with with support. It is manageable. Here the next type is we call pervasive developmental disorder. That means it is not otherwise specified, so it is not very much specified. So PDD-NOS was a category used to describe individuals who showed some but not all the characteristic of autistic disorder. So only one or two characteristic features, only one or two features of autism is present, but not all. So here let's consider an example of Cashew. So, Cashew is a 6-year-old boy. He receives a diagnosis of PDD-NOS. So, what happens? It is not specified. Means here, what happens is we cannot say. As I said, it see the autism differs from child to child. The symptoms, the signs and symptoms will not be same for one child diagnosed with autism to another child diagnosed with autism. So here this boy Cashew experiences, he is a 6-year-old, so he exhibits some social difficulties. What are the difficulties? Such as difficulty in understanding jokes or sarcasm. So this also I had mentioned in the first session of the previous session of autism, that the children with autism will not be able to differentiate between what is normal and what is joke and sarcasm. So it is very difficult for them. If you sarcastically say something to them, they will not be able to comprehend that or understand that. So but he also, what happens is, here displays repetitive behaviors like hand flapping when excited. So this is hand flapping when he gets excited. He displays the like hand flapping things, but he doesn't have any of the speech delays, communication difficulties. He is good with that. So this is called pervasive developmental disorder. That is, this cannot be specified into a type of autism. So the next type is, some people consider this a type of that or others do not. So this is called Rett syndrome. So Rett syndrome is a rare severe non-developmental disorder. Neurodevelopmental disorder. This is a severe form of neurodevelopmental disorder. I'm sorry. So what happens is, this primarily affects girls. So Rett syndrome, we talked that autism is more seen in boys, the 4 is to 1 ratio, boys to girls. So here in the Rett syndrome, this primarily affects girls. It is characterized by a period of typical development followed by a loss of acquired skills, particularly in motor and social functions. That means they will have some motor loss in the acquired skills. That means motor skills, they might not be good at games. Motor skills is in maybe in running, maybe in some of the activities they might not be good. So what happens here is loss of purposeful hand skills. What happens here is children with Rett syndrome often lose the ability to use their hands for tasks like writing or playing with toys. So they cannot here children with this Rett syndrome, they cannot they find it very difficult to use their to write handwriting, and for writing or playing with toys their handwriting is not age appropriate. you know Motor difficulties is they may develop motor abnormalities such as ringing, repetitive movements, and they may have gait abnormalities. They might not walk the same as the normal children. you know they might have the gait abnormalities is walking, and in their movements the abnormalities in the movements, physical movements. So communication difficulties next. Speech and communication skills often deteriorate is even if they have manageable communication skills, with time it starts deteriorating. That means it starts decreasing. The skills they have, it starts decreasing with time, the communication difficulties. That means difficulty increasing with time, and non-verbal communication may become more prominent. Instead of using verbal communication, they might use non-verbal communication. So non-verbal communication such as cues and gestures may be prominent. And social impairments, they may show social withdrawal and reduced interest in social interactions. So as I said, they they prefer to be isolated. And regression here, there is a noticeable regression in skills after an initial period of normal development. So there is a noticeable regression here in skills after an initial period of normal development. So as I said, after you might consider that up to 5 or 6 years, for example, a child is having normal growth, normal communication, normal motor skills, normal sensory skills. But with the time it starts, the difficulty starts with time, all the skills become deteriorating. So this is Rett syndrome. So let's an example of this, let's consider an example for this. So here let's consider Sarah, a 2-year-old. So she had been developing typically, like she was the 2-year-old till now, till 2 years. That child was, that toddler was developing typically good as a normal 2-year-old. However, around her second birthday, her parents noticed a sudden loss of purposeful hand movements. She stopped playing with toys and began showing repetitive hand wringing movements. So, what happened is Sarah's speech also regressed. The words she was able to talk, now she is not able to talk. Now she is not able to communicate, and she stopped making an eye contact. Earlier, she used to make an eye contact while speaking. Now she is not, making an eye contact. And after consulting a pediatrician, she was diagnosed with Rett syndrome. So this is an example of what is exactly the Rett syndrome. The next and the last one is childhood disintegrative disorder. This also people put in the category of division of autism, and some people do not. So, but however, this is a extremely rare neurodevelopmental disorder. This is also a neurodevelopmental disorder. It is called CDD, childhood disintegrative disorder, also known as Heller's syndrome. It is an extremely rare neurodevelopmental disorder characterized by a significant loss of acquired skills in multiple areas of development. So what happens is there is a regression. That means there is a significant loss of previously acquired skills in the multiple areas of development. Here, previously in the Rett syndrome, there was only in the motor development. Here, in the social area, in the communicative area, in the motor skills, everything is, every activity which was done prior starts deteriorating here. So what happens is regression. How it happens is children with CDD experience a severe and rapid loss of skills. So once they were able to do those skills, now they are feeling it difficult with advancing age. That means that were previously acquired. So they experience a severe and rapid loss of skills that were previously acquired. So this regression typically occurs after a period of at least 2 years of normal development. How does this occur? It occurs at least after a period of at least 2 years of normal development. And it starts, the parents starts noticing it, parents, teachers, peers starts noticing it after 2 years of normal development. Matlab, up to 2 or 3 years, the child, the toddler will be normal, typical as another child. But after that age, they start developing CDD. So, and social and communication impairments. So they often display significant difficulties and in social interaction and communication. That means similar to characteristics seen in autism spectrum disorder. So they will have social and communication impairment. That means they are not able to make eye contact, they feel it difficult to communicate with people, they want to be isolated, they do not like it when they are in a social gathering, and it will be very difficult for them to communicate in a social gathering. So motor improvements is there may motor impairments is there may be, handwriting will not be very good, as we discussed, and maybe there may be problems in walking and other moments, and repeated hand gestures or movements may be there, same as in autistic spectrum disorder. This is called childhood disintegrative disorder. So let's consider a classic example. Here, Walnut is a 3-year-old boy, was developing typically until around his third birthday. Here, this child is was a very normal child like any other child till his third birthday. But after his third birthday, suddenly his parents noticed he stopped speaking and making eye contact. He is no longer engaged in pretend play and show a significant decline in social interactions. Usually, if you have seen, toddlers usually do pretend plays. That means if they have some kitchen items, they start cooking, they play with dolls, Mickey Mouse, Minnie Mouse, whatever they are interested in. They play with dolls, the pretend play in the kitchen as well, or in some building blocks as well. Here, after 3 years of age, till the 3 years of age, this walnut was the child was normal. After three, he doesn't want to engage in pretend play, he is not making eye contact, he is not significant decline in interaction with the parents hand in the school. So after seeking a professional evaluation, walnut was diagnosed with childhood disintegrative disorder. So this is an example. So uh, here we come to the end of the types of autistic spectrum disorder. Here, when it comes to managing autistic spectrum disorder, it involves a multidisciplinary approach. So this is a huge it is a huge responsibility. It is a huge topic, so it needs some time. So anyways, I'll just brief it. So managing autism involves a multidisciplinary approach. That means various aspects of a person's development and well-being. So what happens, behavioral intervention should be done. We call it ABA therapy, that means applied behavior analysis. I'll talk about this in the next session because this is a huge topic in itself. Then what happens is we see in that we see individualized approach, we see consistency and generalization, functional analysis is done, we promote positive behavior changes, and there is parent and caregiver involvement here. There is continuous assessment and modification in the ABA therapy. Next is speech and language therapy. For children whose speech and language is impaired, they need speech and language therapy and occupational therapy. So wherein we discussed about wherein there are motor skills difficulties are there, they need a occupational therapy. Next is social skills training. They do require social skills training because they're very lagging in in the social skills. So, and maybe parent training and support, how to deal with autistic children, how to there are parent training and support sessions and caregiver training and support sessions, and educational supports. So if there is any special needs have to be tailored. If the child can manage in the normal school, that is well and good. If not, so there is an additional educational support as well. So I will discuss all the treatment aspects in the next session. All the treatments of autistic spectrum disorder in the next session, and what does ayurveda how does ayurveda help in autistic children, what do we do, and all this is going to be discussed in next session. So share your thoughts on what you felt, and if you have experienced any of the autism cases in your family, or you have any doubts or queries along the topic, so please feel free to share those in the comment section. Thank you for staying tuned, and namaste for today.